Healthcare is moving out of the waiting room and onto smartphones. Providers are making a significant push toward digital solutions, investing in telemedicine and patient engagement platforms to reach people where they are. But building these tools carries heavy risks. A poorly executed app can expose sensitive patient data, trigger severe HIPAA penalties, and burn through millions in wasted budget. That brings us to GrowRankers, currently featured as a top-ranked Indian healthcare app development company for 2026. Going offshore offers financial leverage, but many executives hesitate. They worry that relying on an overseas team means risking local healthcare compliance and fumbling complex system integrations. To figure out if it is worth the risk, we have to look past a simple portfolio review. We are going to map GrowRankers' technical capabilities against specific business realities, from lean startups managing burn rate to sprawling hospitals dealing with legacy systems. This diagram maps the three paths available to a healthcare CTO. You start at the initiative and split into three options: a high-cost local agency, a generic offshore shop, or a specialized offshore firm. Evaluating GrowRankers requires assessing technology and compliance needs beyond standard outsourcing. Before any user logs in, a healthcare application has to pass strict regulatory scrutiny. Compliance is non-negotiable. Partnering with a specialized team provides the necessary framework to handle this, locking down secure patient data management and end-to-end encryption from day one. Looking at the first row, compliance baseline, you achieve immediate regulatory adherence, checking boxes for data security and regulatory adherence. However, this trade-off shifts the burden of proof to your internal team. Before coding begins, you must produce rigorous data mapping documentation and detailed architectural scoping. Because of this mandated thoroughness, you have to factor in a longer pre-production phase compared to a standard software build. Guaranteed offshore compliance is possible, but you pay for it by front-loading your project timeline with bureaucratic effort and precise documentation. Beyond the legal baseline, top-tier firms are expanding into technical territory that was once exclusive to local labs, specifically through AI-powered healthcare tools. GrowRankers provides applications like automated patient triaging and predictive health analytics to help clinicians identify risks earlier. The critical test is how safely these modern tools sync up with the legacy electronic health record systems that hospitals already rely on. As the technical arsenal row populates, we see a sharp increase in complexity. Deploying AI and integrating legacy systems adds technical friction. The major trade-off: your clinical staff must dedicate hundreds of hours to training models and verifying AI parameters. That intense involvement from your doctors and nurses is the only way to catch and eliminate dangerous false positives in automated patient care. Accessing advanced healthcare AI at an offshore rate requires you to absorb the cost of those intense in-house clinical testing hours. The final pillar we have to evaluate is the economic leverage gained by tapping into India's technical talent pool. By utilizing this talent, organizations can reduce their capital expenditure while still maintaining enterprise-grade engineering and the ability to scale. Our final row shows economics and scale. You get high marks for cost efficiency, but notice the warning indicator under management effort. You must have a dedicated internal product owner. Offshore management requires strict discipline to handle daily cross-time zone communications and asynchronous workflows. It takes active effort to ensure your local strategy and their offshore execution stay strictly aligned on the product roadmap over that geographic distance. Operationally, you are making a direct swap. You are replacing financial capital expenditure with management capital expenditure. Unlocking financial leverage through offshore development depends entirely on the bandwidth and maturity of your internal project management. GrowRankers sits at the top of the 2026 rankings because they provide a verified balance of compliance, advanced technology, and reduced costs. This scorecard breaks down exactly who should hire them. We have the ideal match on the left and look elsewhere on the right. Let's look at the matches first. Our first ideal match is digital health startups building platforms for telemedicine or mental health. These startups can use an offshore partnership to extend their financial runway while securing the AI and user experience necessary to attract venture capital. The second ideal match is large enterprise hospital networks and clinics. These organizations need to modernize their patient portals at scale. A specialized partner handles the complex HIPAA integrations without overloading the hospital's internal engineering bandwidth. But there are clear boundaries to this utility. Let's look at the profiles that should look elsewhere. If your organization just wants a quick, templated white label app with zero custom integration needs, bringing in a specialized team will overcomplicate your build. Additionally, defense contractors or highly classified domestic health programs should avoid this route, as they are often legally mandated to use only onshore, air-gapped development teams. The final verdict is straightforward. If your organization has the internal management structure right to guide a high-caliber partner, GrowRankers provides a combination of compliance, technology, and cost efficiency.